Fitness Center Body Max. Bunyur Fitness Center Body Max. Staying fit is a combination of eating well and physical fitness. This you can easily find in Bunyur Fitness Center Body Max. Bunyur Fitness Center Body Max. First, you will get to lose fat easily with amazing exercises. Build your muscles gradually. Fitness becomes fashion, so no pain, no gain. Bunyur Fitness Center Body Max. The way to prove yourself is to better yourself with the kinds of machines we have at Bunyur Fitness Center Body Max. You will easily better yourself, like the rowing machine, leg curl machines, weight benches, rubber plates, double pulley machines, cross trainers, rubber dumbbells, multi-gym machines, and much more. Bunyur Fitness Center Body Max. Remember, we have a state-of-the-art changing rooms, toilets and showers for our esteemed clients, both ladies and gents. Different varieties of foods to aid your self-development of muscles and bones are available at reasonable prices. Regular beat training is also part of our training exercises. For more information, call 7171998, 7171998, Bunyur Fitness Center Body Max.
Assalamu alaikum wa rahmatullahi ta'ala barakatuh. My esteemed viewers, welcome to another edition of COVID-19 Daily Updates. COVID-19 is still here, just in case we are getting carried away. In fact, yesterday was the highest ever recorded new cases of COVID-19 since the pandemic started. And 2/3 of that is in developing countries. That's the most worrying, because we all have seen what COVID-19 have done in the developed world. So now is the turn of the developing world to bear the brunt. So that's why we should remind ourselves about what we can do, what we cannot do, and what are the real facts and what are not facts about COVID-19, because it's been here just for like 6 months, even though it feels like we've been living with COVID-19 all our life. That is because of the impact it has on our daily lives. And now that the numbers are coming down in Europe and America, and these are the countries that fill the major news outlets. But unfortunately, COVID-19 is on the move. It's not static. It's not static. As other countries level the curve and coming down, other countries are going up. And unfortunately, this is the situation. And now the countries that are showing increased extent are countries that have very bad healthcare systems. So that's why we have to go back and remind ourselves, what we need to do to make sure that we don't suffer like how developed world suffers. So as usual, I'll give you the statistics about COVID-19. That is the number of people affected so far since COVID-19 hit 5 million. Past 24 hours, we recorded about 100,000 new cases, and 2/3 of that is in the developing world. So so far, 5,042,788 people diagnosed with COVID-19, and out of that, 327 and 384. And what the TV media didn't mention most often, that the mortality rate for this virus that is 7%. It's not the highest, but for a virus, this is very, very nasty virus that if you catch COVID-19, your chances of dying of it is 7%. That is very high for a viral infection, even though there are other viruses, which more lethal than this, like MERS. I think it went up to 37% mortality rate. But this is in the same category as Ebola. We hear the fear what Ebola brings to Africa and the rest of the world. But because it starts in Africa, it doesn't spread that big, to other part of the world, because Africa is still not very much connected with the rest of the world. When I say that, I mean in terms of airline travel and all that. These can accelerate viral transmission. So out of the total number of people who have COVID-19, 1,997,427 recovered, and these recovered population are going to be very, very essential in our understanding of this virus. In fact, the Chinese again are leading in this area. Right now, they've started testing everybody in Wuhan, and already they discovering lot of people with immunity, and those who in fact never knew they had the virus. So asymptomatic infection is very, very much part of our COVID-19. So that's why we have to be very careful in places like Gambia. Asymptomatic infection is very, very important. Already the Chinese, they discover about, the total number of tests they've already carried out, about 2 to 3%, don't even know they had the virus. But when they look into their immune system or their blood, they discover that actually these people were infected. So that is going to be very, very important in our understanding of this virus. And that's why social distancings are very, very important, because those who recovered or those who developed immune, but they never knew in fact they had the virus. So these are the people who are transferring the virus to other people unknowingly. So that's why when they enforce these social distancing measures, they're drastic in some part of the world, but actually they work. So what social distancing does, it disrupts the transfer chain of the virus. That means if everybody is stay at home, you don't have any chances of meeting other people, much more infecting them. So our fear now is these social distancing measures are being relaxed in the most developed world, and these are the people who travel most. So they might actually be transferring this to developing world who already have a problem already, much more if tourists start traveling across the world. So African countries and other developing countries, they need to double up their control measures mechanism. As I said earlier in the discussion, yesterday was the worst day ever since COVID-19 in terms of number of new infections. So COVID-19 is not going anywhere soon. It's not going anytime soon. Okay, so right now, currently, the number of people currently infected with COVID-19 is 2,770,977. And out of that, that is 97% of the active cases, 98% of the active cases, which equal to 2,672,651 are in mild conditions. And these mild conditions, the people, like I mentioned earlier, some people will have COVID-19, they don't even know they have it. You can only know they have it when you test their blood to find if they have the immunoglobulin cells against this virus, like the Chinese are discovering now. And 2 weeks ago also, UK announced that they now have immunological test which is 100% specific and effective, and it can test whether you had the virus or not. And if you had it, are you resistant to it or are you immune to the virus? So these are going to be very, very important. And this is what is going to be used. I have no doubt about that. The way we travel now, You might go to for visa applications, and they might want to know if you are immune to COVID-19 or not. And if you are not immune, they might ask you to go and do COVID-19 vaccination whenever those vaccinations are ready. So that's why the race is on. The whole world is working overtime to make sure they have these COVID-19 vaccination before the end of the year. It's not going to be easy, but with a determined population, I think it's possible. It's not impossible, but it's not going to be easy. I can tell you that. So far, 1,997,427 recovered from the virus, and we have 320 deaths. So I'm going to read to you past 24 hours, the countries that have registered the most numbers. US recorded 8,611 new cases and 616 deaths, and Russia recorded 8,764 new cases and 135 deaths. And Spain recorded 721 and 110 deaths. And Brazil, for the first time, past 24 hours, 48 hours, they recorded over 1,000 cases per day. And their president is still denying that this is something serious. But you look Brazil, you look at their burial grounds, it's just heartbreaking to see so many burial, been dug and people have been buried. It's just unbelievable. Brazil recorded 3,497 new cases, 141. The number for UK is not yet in. I'm not sure why, but they recorded 3,363 new deaths past 24 hours. Italy recorded 665 new cases and 161 deaths. France, the new cases not yet in, but they recorded 110 new case of death. Germany recorded 343 and 20 death. And Turkey 972 new cases and 23 death. And now I'm going to read to you the countries that are very, very close to the Gambia. Yeah. Countries that are very close to the Gambia, the progress, the spread of COVID-19 is very, very, very scary. Like Senegal, yesterday they recorded 97 new cases, and so far Senegal recorded 2,714 cases so far, and Guinea Conakry is the highest now in our part of the world. They recorded 2,863 cases so far, and Guinea-Bissau, which 2 weeks ago have only 54 new cases, and now they have 1,038. And Mali recorded so far 901 cases, and Burkina Faso 801, and the Gambia still 24. So that brings me back to my topic for today. That is the myth and facts about COVID-19. There are a lot of still, misinformation about COVID-19, and there are some of the things people think they are right, but they are not about COVID-19. And one of that is the mask. We've seen in fact countries making this mandatory, for people to wear a mask. I think it's out of fear. But according to Centers for Disease Control in the US and also the WHO, they do not recommend the use of face masks for the general public to prevent the corona disease. So this is a myth. It might look weird, but that's the fact. Not that because everybody believes it, that's the fact. It's not going to help. If you are taking care of a sick person or you are sick, it's good you keep your cough or your sneeze to yourself, and in that case is okay. But for healthy population, it's not recommended by WHO. And as far as worldwide pandemic, this worldwide pandemic is concerned, there is no higher authority than WHO. They base all their advices on facts and research. So if you don't have a face mask to go out, it's not a big deal. But if your country said you have to wear it, you have to wear it, because then you will be breaking the law and it can land you into trouble. But what is fact, what is still true about COVID-19 is to avoid close contact with sick people, you know. And also we should still clean and disinfect objects and surfaces that may have germs, like for example our computer our keyboards, or tabletops at work, and also in public spaces like railings of the bus and all that, and seat covers. We should be careful not to touch those places, and if we do, we need to disinfect quickly. And also we should continue like disinfect now that these social distancing guidelines have been relaxed. So this is a good time also. Public transport need to be regularly disinfected, where so that people cannot start catching this virus again. Again, the most effective way of preventing or cleaning hand is soap. Any kind of soap, as long as it lathers, that will kill the virus if you make sure the soap is on your hand for at least minimum of 20 seconds. So fact, this is what I'm going to do. That's a fact. You can make a difference, right? Simple tasks like hand washing, getting a flu shot, and staying at home when you are sick can make a huge difference. Still, it's not very clear why, but those who have flu jab, like vaccination for flu, tend to be more resistant, against COVID-19. So maybe if it is too not too late, it's not bad to go and take your flu jab if you know that you live in a country where this virus is endemic, because COVID is nasty. It's a virus, and even healthy people, this virus can cause monumental damage to us. And cough and sneezes into tissues, then wash your hands all the time. These have to be a way of life. Maybe before COVID-19, people don't take these things seriously, but now we all have to live by these simple respiratory hygienic rules. And also, if you don't feel well, if you are having a flu-like symptoms, please call your doctor. Because the symptoms are similar, even though there are some clear-cut differences, like runny nose. You hardly get runny nose with COVID-19, but you can get in common cold. And you can have headache in flu, and you can have it in COVID-19 as well. You can have a sore throat in COVID-19, and sometimes you can get it in flu. So these are some of the areas that are not clear cut. But if you feel like you are feeling a little bit chill, you have headache and persistent cough, the best thing to do is, is to call your doctor. And also, there are good reasons to be wary of virus and people from affected regions. You know, yes, it's good, like, this virus started in China, and all of a sudden the Chinese things, it's the Africans who are spreading it. So this is a myth. It's good, we can be wary for people, or we shouldn't be doing something that these people will feel that they have been discriminated or they have been picked on. That is not normal. Some anxiety is natural during a new public event like we are having now, especially when there are many unknowns. Like I said yesterday in my presentation, there are a lot of things we still don't know about this virus. So that is a fact. People have all right to be scared, to be anxious, meeting new people. But we have to take care, just as important care of ourselves. Do not make assumptions about others based on perceived symptoms or racial or ethnic characteristics. We've seen the Chinese do this to African people in China, and we've seen how the videos went viral, and this caused a lot of anger in Africa. And I think this is going to affect China big time at diplomatic level in the long run. So you care, compassion, and empathy for each other, and makes a difference. If people are sick, we cannot shun them. We cannot discriminate against them. Of course, we have to take care when we are dealing with people with COVID-19 or any kind of respiratory illness, but we should be careful not to make them feel bad about themselves. This is a fact. Misinformation is like a virus. There's so much of it. especially in our Gambia community, you open these WhatsApp audios, some of the things you hear about this virus, out of this world. I don't know who are cooking them and spreading them, but they can be as dangerous as a virus. Like earlier part, during the pandemic, I've seen one Arabic script. It's like a nicely choreographed, Arabic script, and the guy was explaining that all you have to do is to look at that picture. If you see that picture, that means you are resistant to COVID-19. It doesn't come daft than that. But why people are spreading them? Because they believe it. You know, once I saw it, I don't believe it. I thought it's an absolute nonsense, so I just delete it. But people who send it might be believe it. Okay, let me send it to my friend so that it can help it. So these are some of the information. I mean, they are just like a virus. They can kill people. So check your references and your assumptions. Like if you have something you have doubt about it, go to Google and search. And if you search Google, also look at the information where that information is coming from. It has to be credible. Luckily our time we are lucky. We have if you want credible information, there are a lot of online sites where you can go and and quench your inquiry. So for example, as far as COVID-19 is concerned, Johns Hopkins, they are doing a very, very good job. Universities like Cornell and CDC, Centers for Disease Control. And even in Gambia, MRC, they have a very, very, very good source of information about COVID-19. And the Ministry of also, I think they are adapting their advices from MRC. But these are good, pretty good. So if you want information or you doubt about something about COVID-19, please go to these websites or speak to qualified medical personnel. Stop taking your PO or your preventive measures from these WhatsApp forums. Yes, there are some credible information, but there's so many bad information in these social media that it's difficult to tell for our trained eye to know if this is a fact or a myth. So questions whether your concerns are rooted in facts or personal ideologies. So that's my topic for today. Yeah, that's the myths and misconceptions. So COVID-19 is a viral infection. Allah doesn't bring it to kill the infidels like we believe earlier, because the Chinese are horrible to other Muslims, and that's why COVID-19 bring it. Even in that early stage, once I saw that information in our my class of 92 website, I told them, no, we have to be very careful here. This is a new virus, and the Chinese are well advanced. They're going to get over this. So maybe by the time it gets to us, we can maybe it can be nasty because our healthcare system is actually almost non-existent. We have to accept that, and also our attitudes. We have seen how even the fight even began. We have seen how our healthcare officers are more concerned about sharing the money that is meant to fight this COVID-19, and they are actually distracted. Even though WHO is continuing reminding us in West Africa this virus will peak around June, July, and we have seen the numbers going up in Senegal, Guinea-Conakry, Mali, and Guinea-Bissau. And yesterday, after almost 6 months since we have COVID-19, yesterday was the worst ever in terms of total number of new cases. And what makes that number scary and worse, these are 2/3 of it are from the developing world. So it's like the developed world already they flatten their curves and the numbers are coming down. They even start relaxing their social distancing measures while we are approaching the peak. And if you say we lack the discipline, people will say, "Wow, you insulted." But this is the fact. Sorry, my English vocabulary is not very big, but Africa generally we lack discipline. We have to be hit practically with something before we believe it, and I think that is not good. Just look at the case of the Gambia. you go to the big Gunjuru Beach, Tangi, or even Serekunda market, you feel that give you a feeling that actually might be there is no pandemic. So people are criticizing this state of public emergency why the president extended. I think it's a good thing. Some critics will tell you, well, you go to the Gambia, it feel like there is no social distancing. The only slight good news about that is places where people are crowded is mainly in the open. I'm not trying to take excuse for people crowding together. There is no reason why we should. And there's no reason why we shouldn't observe the social distancing anywhere in the world. But if there is not state of public emergency, the churches and the mosques are going to be open, and these are confined spaces. If you go to these mosques, the Salafis will tell you you have to be tied together. Tarasu, they will stand purposely and tell you to make sure you are too close to each other. So that's in that sense is good. You're not going to have a lot of people like this Ramadan, very close to each other in the mosque in a confine. And most of these mosques, we have to be honest, are very, very poorly ventilated. So in that case, it's good. You might not be doing the trick 100%, but at least I think it's still useful. And also it's good to cut down, like if they say the shops close at 2 o'clock, it make a big difference if shops should open anytime they wish and close at any time they wish. So that's the good thing about it. I come to today's end of today's show, and tomorrow Ben is here again, and as you know, Ben is never disappoint. Ben will critically analyze these big pandemic, well, I say financial corruption pandemic in the health ministry that is brought to the fore because of this COVID-19 fund. Ben will come here tomorrow, inshallah, and he will critically analyze that. And on Friday, we have a panel discussion about World Wildlife Day. You can't afford to miss that because Omar Sao, as you know, Omar Sao will be here, Omar Malmo, and Dr. Malan Dinkete also will join us from the Environment Ministry, and also the indefatigable Lamin Tamba. Lamin Tamba, I think you should know him. He's one of the smartest guys, youth guy, the fact to come from the Gambia. Lamin Tamba will join us. So please, tomorrow on Friday, join us.
Planning to have an uninterrupted electricity and water supply from solar energy in the Gambia and beyond? Worry no more, because Solar Enterprise will provide you with the solutions at reasonable cost. We have experienced.
Yeah, so please share the video, and I will see you tomorrow, inshallah. Thank you.
Planning to have an uninterrupted electricity and water supply from solar energy in the Gambia and beyond? Worry no more, because Solar Enterprise will provide you with the solutions at reasonable cost. We have experienced personnel who can install and advise you about your electricity and water supply with a warranty period. We have good quality solar products from North America and Europe. We provide services and sell products to individuals, organizations, institutions, private offices, communities, and government. These products are solar panels, batteries, charge controllers, inverters, water pump, water heaters, freezers, submersible pumps, and general solar accessories. Visit our stores at 48 Karaba Avenue and Brusubi Highway, or you can call us on 7657 479 980 8483 340 9400 or 635 9906.